Hello, thank you for watching another Nurse Maddie video. Today we're going to be talking about PTSD and your PNES. So the theory out there is that PTSD is an underlying condition that can cause or attribute to some of your PNES attacks or seizures, whatever verbiage you would like to use. So the basic treatment, whether you have PNES or not, for PTSD, just know there's help out there and it can be curative. So psychotherapy, gold standard for treating PTSD. You want to see a therapist that specializes in trauma, especially PTSD and other traumas. So you want a trauma-based therapist, okay? You want one that will do CBT and EMDR and other psychotherapies specifically around the traumas you've experienced in your life. So with PNES, the theory of doing this is that it will help reduce the number of seizures or completely take them away if it is in fact being caused by your PTSD. Okay, I'm a little torn between this being a causative factor and more of just an underlying factor that should be taken care of. Anybody with PTSD should seek mental health and get it taken care of as soon as possible. So I myself has been diagnosed recently with PTSD. I've had it for a very long time, but of course just recently got it diagnosed. And I am going to be having my first psychology appointment with a PNES and trauma-based psychologist. Now, I am going to have that on June 17th. I'm going to see if she will let me record any of the activities or if she's okay with that, so I can kind of show you what goes on during a session, so that maybe it'll help you. Okay. So I will let you know after that appointment whether I was allowed to post or not. I will tell you what kind of went on, what we did, how I felt afterwards, and perhaps if I had any less seizures afterwards. It's worth a shot. Your mental health is very important. So treating any underlying causes, anxiety, depression, traumas, and PTSD is what the recommendations are right now. So we shall see. We shall definitely see if this will help lessen my seizures on the daily, even though I did have a concussion and it started 3 days after. But I'm going to be hopeful because I'm willing to try anything at this point, because being unable to work and unable to do a lot of things right now is very frustrating for me. I'm a very active person. I was a full functioning registered